Hello and welcome to this meeting. So for this meeting, I'm going to present in my data science in practice continuous assessment report on COVID-19. So what you're looking at here is the complete report on Microsoft Word. So without further ado, let's dive in. So this report covers five key areas, which is global trends, comparative analysis of countries, with like the US, the United Kingdom, and Canada, a country-specific focus, which focus on Canada, and also government response effectiveness, how government response effective it was, a key statistical relationship. So without further ado, let's dive in. So here is the introduction. So the introduction basically talks about the background of the COVID-19 pandemic. As we can see that by December 2022, there has been more than 649 dead, first 649 million people being infected by the COVID-19 with over 6.65 million people dead. So you can see there was a very devastating pandemic and caused a lot of destruction to the world. So as you can see here, these are my research questions. So the research questions is aimed to try to, like I mentioned earlier on, to determine the effectiveness of the government response, a comparative analysis of different countries, a country deeper analysis of Canada as a whole. So this is how the methodology, how I obtain my data, understand the data set, the variables that I use within the file. And also if you go to the general overview, so according to the information, according to a report, we can see that the COVID came in very stages. So, for example, the first wave was from January to May 2020 and mainly affected East Asia, Europe, and North America, whereby the second wave came around August 2020 to February 2021 and was more geographically spread out. And there was a Delta variant, which was in from April to October 2021. And then there comes the Delta. So there comes the Omicron. So the Omicron variant was from December to March of 2022. It caused the most dramatic, it caused the most panic, but it was the one that has the less effective of fatality rate. So I'm going to move on to Canada. So I'm going to move on to Canada specific. So here is Canada specific. So Canada gives a unique uh, COVID-19 experience. So I conducted deep analysis focusing on provisional variation and distinctive patterns, within Canada, because Canada recorded first case on January 26, 2020, with the first death occurring 49 days later on, which was on March 15th. So this time frame from the initial case to mortality was significant compared to other countries. So if you look at here now, if you look at the graph of the amount of death and then also like the amount of cases that they have, you can see that there's a bit of stability. Like it was the peak of the pandemic when everything was happening between 2021 to 2022. So this gave me, so we can see here at this again, using the graph to compare the new cases of COVID-19 and the death as well. So you can see there's a huge spike in 2022. So I did a comparative analysis. So I used to do the comparative analysis, I used the stringency index to analyze policy strictness. A key pattern emerged. So, strict measurement often lagged behind cases shared by 2 to 3 weeks, suggesting a retrieve rather than a proactive response. So you can see here that like the Canada has confirmed cases of about 8,614 with a death of 99, whereby the USA has 26,000 cases confirmed around that time with 301 death, and then the UK has 27,000 cases with 302 deaths. So we can see from this graph that even though the United States has more cases, they recorded less death compared to the UK, which was very, very interesting. And also I compared the daily average of the 7 days average of cases per thousand. So if you look at this graph, you can see that there's you can see that the key findings that are okay, the United Kingdom report the most extensive case per thousand per 100,000 with 36,946.1.6 cases, whereby the United came second with 30,576, and Canada death rate stand at 12,531. So you can see that the death per 100,000, the United States remain the most with the death per 10,000, even though the UK has more cases tested than the United States, and Canada relatively remain stabilized as their death per 10,000 per 100,000 was stabilized. So I have did some regression analysis and key findings. So if we go to this page here, so this is very interesting page. So I did some regression analysis to demonstrate the comparative analysis, and the things I find was very crucial. So for example, the findings are some of the findings that I found with my hypothesis testing was that the policy stringency versus case rate provide a positive correlation exist, which was likely due to the reactive measurement being implemented during the case spike. We can also see that vaccination versus case fatality rate, a strong negative correlation, which was coefficient of minus 1.021 r to the power of 2 equals 0.521, shows that the higher vaccination rate significantly reduce mortality. And also when you look at the new cases, and versus death pre-vaccination and post-vaccination. After vaccination campaigns, the same numbers of cases results in a few deaths, providing the efficiency. So for some extra learning or independent learning, I implemented these regressions models using stand model in Python with the timeline. Also implementing a row correlation analysis to track delay effect, and also a custom twin axe plot to visualize multiple metrics simultaneously. I also developed a molecular analysis pipeline in my file, which sequentially run all my components at once. And in conclusion, I can confirm that this report highlight three key takeaways. So government react to rising cases rather than the proactive preventing of them. Vaccination significantly reduces mortality rate, and also the relationship between cases and death um, fundamentally changes post vaccination rollout. And these findings reinforce the importance of proactive case policy rather and rapid vaccination development and data-driven decision making in future pandemics. And an interesting thing that I also find that Canada achieved the highest vaccination rate. As if I go here, so Canada recorded about 82.5% of its population being vaccinated, which was a massive deal compared to other countries like the UK and United States, as well as the Canadians were not very hesitant when it came to vaccination compared to the other countries, which citizens were very hesitant and were not willing to take the vaccine. So this is my report and this is my demo on the COVID study. Thank you for listening, and everything will be on YouTube, so you